Welcome to WakeGOV TV. I'm Eric Curry. Thanks so much for joining us today. Wake County has a new director to lead Wake County EMS. We'll have details, plus we'll share with you what's being done to help citizens living in unincorporated areas of the county find transportation. But first, in December of last year, the Wake County Board of Commissioners selected the new chair and vice chair to lead the board in 2016. The chair and vice chair will help set goals and priorities that best meet the needs of the citizens of Wake County. It is indeed an honor to welcome to WakeGOV TV for 2016 Chairman James West and Vice Chair Sig Hutchinson. Thank you both for being here.
Thank you.
As we begin another year, we'd like to take an opportunity for the viewers, especially those that have moved to the county since last year, to learn more about you as individuals and to talk about the board's priority goals that you hope to set and to focus for this year. So Commissioner West, you've been on the board for 6 years now, old pro at this, and this is your second stint as chair. Could you share with us a little bit about your professional and personal experiences and service to the citizens of Wake County?
Thank you so much, Eric, and Happy New Year to all of our listeners. I grew up on a farm, and I earned an undergraduate degree in agricultural engineering from North Carolina A&T. While working with the Extension Service, I earned a degree and a master's in adult community college education and also a doctorate during that period of time. I served as Director of County Operations for the North Carolina Cooperative Extension Service, wherein I worked with all of the counties across the state. I served 6 consecutive terms on the Raleigh City Council up until 2010 when I joined the Board of Commissioners. And during that time, I was Mayor Pro Tem 6 to 8 of those terms.
Okay. Commissioner Hutchinson, this is your first term on the board. Could you share a little bit about yourself, including your professional and public service career, which many folks know that you've been very active in the community for several years.
Thanks, Eric. It's great to be here. I would love to have the opportunity to do that. So my wife and I have been here for 30 years. Originally came from West Texas. We raised our son here. He went through our public education system, and now as a physician, as part of that public education system in Tallahassee, we have 3 beautiful grandchildren. Many of the citizens know I've been active in community advocacy and affairs for 20 years. Early in my career, I started around open space and Greenways. I'm really known for the Greenway system here in the Triangle and supporting and helping build that out. I've led 6 bond referendums for open space preservation, for parks, for greenways, for affordable housing, and for transportation, close to $280 million, those 3 with the county and 3 with the city, working to make Wake County, city of Raleigh, a better place to live for our citizens. As you know, I've been a big advocate for transportation and transit, serving on the Triangle Transit, the Regional Transit Agency Board for 7 years. And so this last year, I thought the best thing that I could do to help move Wake County forward would be actually to run for county commission, which I was very fortunate to have supporters and voters, and was elected last November.
Okay, Commissioner, what made you want to serve on the Wake County Board of Commission?
Well, I've always been, about the only thing I'm really good at is getting things done. And but I'm really good at that. I'm not good at a lot of things, but I'm really good at that. And you know, being an elected official to me has never been an end goal. It's ultimately, how can I make this community better? I get up every day thinking about how can we double in size, which is good, growth is good. But how can we double in size while improving our quality of life? Not just maintaining our quality of life, but improving our quality of life.
Commissioner West, the same question for you.
This job to me is not just a job, it's a calling. It is actually, every day I get up, I'm working on my soul in terms of how I can help people to have a better quality of life. Actually, as I look at what I do here is tied to my purpose, and I connect my purpose to my destiny. And so it helps me to really get a lot of fulfillment, a lot of satisfaction, because I love to see people grow. Philosophy we have with the North Carolina Cooperative Extension Service is that help people to help themselves, to use the research and knowledge base of those two great universities to improve the quality of life. So I think it's tied to what God meant for me to do, and I'm still working on my soul.
As the chair and vice chair, what do you see as the priorities for this year? First you, Chairman West.
Well, there are many priorities. We just left an agenda meeting looking at our retreat, and we all left there real excited. I think that we have some real significant goals that will make a tremendous change and impact on this county for everyone. And we're really committed. We have the talent to make these things happen. I guess you always will think about economic development. So I think it's very important that we continue to attract and retain and grow new businesses because that's kind of the bottom line.
And Mr. Hutchinson, priorities you view as important this year?
Right now, Eric, we're experiencing amazing growth. 66 new citizens are added to Wake County every day. And we see that, Dr. West and I see that as very positive. We want to leave the welcome light on. We feel these citizens have a lot to offer to Wake County, and we want to leverage their intellectual knowledge as well as their physical capital to make our county even better. That being said, that all of that blessings provides areas that we need to be addressing, so I would identify 4 specific things. Number one priority for us is to provide more transportation options by passing the transit referendum that we'll be putting on the ballot in November. Number 2, I think, is economic development and creating jobs. Number 3, near and dear to my heart, is always open space, parks, and greenways, which add to our quality of life, which brings many of our citizens here, or keep those citizens that are already here in place. And fourth, something that I'm particularly interested in is building a culture of health.
Thank you. I'd like for each of you to share your thoughts on this next question. Commissioner Hutchinson, you first. For 2016, can you tell our viewers what most concerns you about Wake County? What are you most proud of, and what do you see as the next big achievement on the horizon?
I really don't think in terms of concerns. I frame these concerns as opportunities, and we are so blessed with so many opportunities. And so now, as I said, the question that I get up thinking about every day is how can we double in size in the next 20 and 30 years, and while improving our quality of life, not just maintaining, but improving our quality of life. We need a transportation system that works. We need a public education system that is nationally ranked and second to none in North Carolina in terms of educating our young kids. We are poised to continue to be a 21st century region, and we look forward to living into that opportunity.
And Mr. West, I'll repeat the question. For 2016, can you share with the viewers your concerns about Wake County, what you're most proud of, and what do you see as the next big achievement on the horizon?
Commissioner Hutchinson shared, I think, some of the more specific issues that we need to address, and I do think we are poised to really be great by choice. You can have a positive vision and you can have a negative vision. I think my biggest concern is that we got to have a broader vision, so we're going to have to, I think, be very strategic in terms of making sure while we serve the people locally in each of our districts that we don't forget the big picture and become fragmented.
Dr. James West, Chairman, Mr. Sig Hutchinson, Vice Chair of the Wake County Board of Commission, thank you so much for being here.
Thank you, Eric.
Thank you.
Coming up, we'll share with you a program aimed at helping Wake County residents with their transportation needs. Stay tuned.
They say that when you're facing extreme danger, your life flashes before you. If you think that's sad, consider facing it before you even have enough life to flash before your eyes. Deaths and injuries can be prevented by using the right car seat. Visit safercar.gov/the-right-seat to know what is appropriate for each age and size.
Hey,
Look at Mommy.
maybe the light hurts his eyes.
Maybe she's just not hungry. Maybe it's a phase.
Avoiding eye contact is one early sign of autism. Learn the others today.
And welcome back. As you know, Wake County is one of the fastest growing counties in the nation. And while the two largest municipalities within Wake County have mass transit options for citizens, those living outside of the two urban and unincorporated areas of the county have very limited options for them. Wake County Human Services Transportation Services provides a variety of transportation needs for eligible participants. Eligibility is based on sponsorship by participating agencies in programs such as Medicaid, public health, workforce, and other programs. Joining us to talk about the services offered in Wake County is Don Willis, the manager of TRAC's program, Wake Coordinated Transportation Services. Thank you so much for being here.
Thank you for having me, Eric.
I guess the first question, Don, simply is, can you tell us a little bit about Wake Coordinated Transportation Services and what it provides?
The Wake Coordinated Transportation Service is a demand response transportation service provided in a shared ride way, which means that the service will come to your door and it will take you to the door of where you're going. But it's a shared ride, it's not a taxi service. You have to be willing to ride with other people to get the trip done.
Don, how does the TRAC's program work, and why is there such a need for this program in Wake County?
The trips we provide must be paid for by an agency or program such as Medicaid, and so it's important that we determine your eligibility under some of those sources. Most of the folks that ride are on Medicaid, but we can qualify you using an elderly or disabled funding source if we can prove your age or disability as well. There are many people in the rural areas that have no public transportation options at all, and so the van service could be made available to them based on their location. It's a very limited service that's made available on a first-come, first-served basis. People have to call the day before the service is provided, and if they don't get in time, they may not get a trip that day. They also have to be willing and able to pay a small fare to ride. It's either $2 or $4 each way based on the distance of the trip.
Okay, and the form of payment we were talking about, is it just cash?
It is. It's currently just cash.
Okay. How can folks find out if they're eligible? They must make a phone call? Is it just that simple, or can they go online?
Most of the people that we serve are eligible through Medicaid, and if we're able to help, we can also do it by documenting their age or disability, and that could make someone eligible as well. The best way to find out is to call our customer contact center, though, and they can determine by talking with a representative if you're eligible. But you can also go to our website, waketracks.com, and also get some information on the program at that location.
And of course, it's no secret to anyone that Wake County continues to grow, which means that there are more citizens coming to the area and are living and finding homes in unincorporated areas. How do you reassess the service that's already being provided, and how have you been able to improve service for the citizens?
Well, Wake County certainly is a fast-growing county. I understand we just went over 1 million people, and our service is in demand like it never has been before. We either performed or arranged over 200,000 trips last year, and that's a 20% increase over the year before. So the demand for our program right now is tremendous. This increase in demand has stretched our ability to serve those who need the program. So we've taken a number of steps to better serve those who are demanding the service. We've added vendors to do more trips. We've sought out grants to fund more vehicles. We've invested in new technologies to improve on the services that we provide. We've invested in a phone system to improve the call quality. Our WakeTracks website is a perfect example of something that we're trying to do to better serve the public. We received a grant to create this WakeTracks website, and that grant was intended to help get out more information to the public about the services that are available.
And Don, you mentioned before earlier in this segment, but how can citizens find out more about the program?
Well, we hope that they'll call our customer service representatives at 919-212-7005, but also visit our WakeTracks website, where you'll find a lot of information, our policies and procedures, our service brochures. There's a customer bill of rights and responsibilities, a lot of good information on that website, and we hope people will take a visit.
Don Willis with Wake County Coordinated Transportation Services, thank you so much for being here.
Thank you, Eric.
Stay tuned, we'll have more on WakeGOV TV.
This is the moment I knew his future had no boundaries.
There are some moments only the forest can inspire. Find yours at discovertheforest.org.
Welcome back. Beginning on January 1st, new guidelines went into effect for food stamp recipients that are jobless due to new federal rules. The guidelines affect able-bodied adults without children and who receive benefits under the Supplemental Nutrition Assistance Program. Joining us to talk about the guidelines is Janie Flint with Wake County Human Services. Thank you so much for being here.
Thank you.
We understand that there is a new work requirement for individuals that receive food and nutrition services or food stamps.
Yes.
It sounds very confusing to some. Can you explain?
Yes. Effective January 1st, new requirements went into place for 23 North Carolina counties, including Wake County. And it impacts individuals who are between the ages of 18 and 49, who do not have children in the household, and who are able to work. Those individuals have to meet a work requirement each month to maintain their benefits.
Now, what are the approved activities to maintain those benefits?
There's several options. One is to be working 20 hours per week in paid employment. In addition, other options are to be volunteering, be participating in a work program, or to be in training that is approved. Activities that are volunteer or agency related or work programs do need to be pre-approved by our agency and have certain documentation and requirements that have to be submitted. And if the hours that an individual is engaged in drop below 20 hours per week, that is a change they do have to report.
Are there exemptions to this requirement?
Yes, it is definitely tied to their ability to work. There are certain aspects, physically or mental reasons that people may not be able to work, as well as conditions such as chronic homelessness, substance abuse issues, pregnancy, as well as if they're in a caregiver role, or if they're participating, if they're receiving unemployment or participating in the Work First program. Those could be all things that would make them exempt from the requirements for this work requirement. Additionally, there are 3 months available to individuals between January of 2016 to December 31st of 2018. There are 3 months available for to receive benefits when you do not meet the work requirements.
And obviously there are a lot of requirements. Some could be confusing to some. How can an individual find out more information about the approved activities or possible exemptions?
We have a couple of different ways for people to reach out to us. We have 2 telephone numbers that we have set up, as well as we are conducting information sessions on Mondays, Wednesdays, Thursdays, and Fridays at 4:15 at our Swinburne Human Services location.
Okay, now we're going to switch over to another program that you are heavily involved in, the Low Income Energy Assistance Program. This is the time where folks will need that help. Can you provide an overview of the program and how citizens can get more information about it.
Yes. The Low Income Energy Assistance Program, known as LEAP, or known previously as the Energy Check, is an annual program that provides low-income households a one-time vendor payment that goes directly to their heating source for either $200, $300, or $400 based on their family size and their income. And that needs to be applied for each year, and applications can be submitted through March 31st.
And you mentioned through March 31st. Are there other ways that individuals can submit their information?
Yes. Applications can come through the mail. You can come in person. We do have daily, we are offering group application sessions throughout the day from the Wake County Human Services at Swinburne. And you can also apply at our regional centers, which are in Fuquay-Varina, Wake Forest, and Zebulon. And we also have community partners that are accepting taking applications to assist us.
And what's the best way that citizens can request an application or get additional information?
The best way is our email address, which is leap@wakegov.com. And we also, you can contact the 919-212-7000 number to request that information.
Okay, Janie Flint with Wake County Human Services. A lot of changes in your department, but thank you so much for sharing that information.
Thank you for having me.
When we return, we'll introduce you to Wake County's newest Director of the Emergency Medical Services.
They said I couldn't dream. Called me a piece of trash and swore that's all I'd ever be. Said a bottle couldn't see the ocean. Give up. Go back to the dumpster. But I didn't listen. I made my way. And now, I am what I've always wanted to be.
Recently, Dr. Jose Cabañas began his tenure as Wake County's Director of Emergency Medical Services. Dr. Cabañas returns to Wake County after serving as Deputy Director for the Travis County Emergency Medical System in Austin, Texas. Dr. Cabañas replaces longtime Medical Services Director Brent Myers, who resigned last year to work in the private sector. Dr. Cabañas joins us on WakeGOV TV for the first time and talk about his new role. Thanks for being here.
Thank you so much, Eric, for having me. It's a great pleasure to be back in Wake County, what I consider my home and EMS system, and it's a pleasure to be back. Thank you for having me.
So a lot of citizens in Wake County may not know you. Can you share a little bit about your background?
Absolutely. Again, my name is Jose Cabañas. I am the new EMS Medical Director, and I was born and raised in San Juan, Puerto Rico, where actually I grew up until 2008 when I migrated, when I moved here to North Carolina to pursue an EMS fellowship training. I was a pre-hospital first responder for many years in Puerto Rico. I did my medical school training and residency training in Puerto Rico. From there, I came to North Carolina to fulfill my passion of wanting to be an EMS medical director, so I did my fellowship training here with Wake County EMS in collaboration with UNC Chapel Hill, where I did my Master's of Public Health and some research activities.
What are your responsibilities as Director of Emergency Medical Services and as the Medical Director?
So there's two main functions to my position. Number one is making sure I'm responsible for the overall operation of the system. Granted, we want to make sure that every decision that we make keeps our patients at the center of everything we do. As a medical director, I'm responsible for the clinical operating guidelines and the specific guidelines we provide our providers So make sure that they can treat our patients in the field and making sure that they have the education to achieve those goals when they're taking care of patients.
And I guess the average citizen probably has an understanding or that, when they talk about a paramedic or emergency responder, that all they do, what they probably see on television, they get the patient in the ambulance and they call into the hospital to get direction. But little do they know there's an actual doctor on staff for Wake County EMS.
The fundamental function of any EMS systems is to provide access to emergency services to the community on a 24/7, 365 basis. So I am in contact with our providers 24/7. They need a consult, they need a guidance, we need to respond to a scene, whatever that is. I am Wake County's emergency medicine doctor 24/7.
And as a nationally recognized department, how do you plan on maintaining and really uplifting the initiatives of the department?
Wake County is a leading EMS system in the nation. And there's several things to this. Obviously, as any new position, the first 6-8 months, we're trying to engage in communication with our workforce, communicating with our community stakeholders, talking to our strategic partners in our community to understand what the needs are, what's the progress on the ongoing projects that we have as a system, and from there make decisions on realignments of priorities with the ultimate goal that we're providing the highest quality care to our community.
With your experience working in the medical field, do you feel the current changes have been beneficial to Wake County's EMS department and also the community, such as the integrated health care?
So our community paramedicine program, also known locally as the Advanced Practice Paramedic Program, is probably the most innovative program of this nature in the country today. Wake County, as a system, have made significant commitments and investments to make sure this program is successful. And I can tell our community that we have made significant clinical impact on specific target populations that require more than just access on a traditional way to go to the emergency department. Granted, there's still a lot of moving parts to how healthcare is going to finalize or end up in this reform, financial reform that's been going on for the past several years, and how can we take advantage of that future financial structure in the healthcare system that we can position ourselves to recoup some costs and actually add capacity to that program.
Dr. Jose Cabañas, Director of Wake County's Emergency Medical Services. Thanks for being here and welcome back to Wake County.
Thank you, sir. It's a great pleasure to be back.
Yes, sir. Keep up with the latest Wake County news by visiting us online at wakegov.com/news or on Facebook or Twitter. That's our show for today. Thanks for watching.